Welcome to the Health and Government Operations Committee. We will be voting on vote list number 19. The first bill is House Bill 572, and I move to allow the sponsor to withdraw the bill. Is there a second?
Second.
Any discussion? All those in favor say aye. All those opposed, no. The delegate will be allowed to withdraw his bill, and the vote was unanimous. Senate Bill 242, Aaron.
This is the cross-file to House Bill 109. The bill requires MDH's newborn screening program to screen for each core condition listed in the U.S. Department of Health and Human Services recommended uniform screening panel. On or after January 1st, 2023, the Secretary of Health and the State Advisory Council on Hereditary and Congenital Disorders must determine whether to approve the inclusion of a condition within 1 year after the addition of the condition to the panel. There is a reprint of the bill as passed by the Senate. The bill is almost identical to House Bill 109. It sets forth the procedures that are to be followed when a core condition is approved or not approved. What it does not include is the specified language related to procuring specialized equipment if necessary after a condition is approved.
Delegate Penny Melnick.
Yeah, this bill did not go to subcommittee because we had the original bill, so it's almost the same. So the Senate just took the procurement language out, that's all. I
Okay.
moved the, is it amended, right?
Yeah, it's the
Yes, it
amended
is amended.
Senate Bill 242. It's already amended. It came to us in the form that it's in.
I moved the bill.
Second.
You're moving amendments, Madam Chair, you're moving amendments.
Oh, I'm sorry. I was wrong. I thought that it was already amended. Okay, we moved the amendments and we had a second. All those in favor of the amendments to remove the procurement stuff, raise your hand. All those opposed? No, that was say aye. All those opposed, please raise your hand. The amendment passes unanimously.
Bill as amended, Madam Chair, Chairman.
Second.
Discussion. All those in favor say aye. All those opposed, no. The ayes have it, and the bill passes unanimously. Senate Bill 244, Aaron.
There are no amendments on this bill, and it is identical to its cross-file House Bill 534, which passed unanimously.
Second.
Any discussion? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. Next, we have some concurrences and such like. And we'll start with, how about Lindsay? House Bill 375.
House Bill 375 is the Open Meetings Act application and enhanced requirements. The amendments are conforming the bill to Senate Bill 269 as it passed the House. It's exempting site visits and educational field tours from the entities that are have the enhanced Open Meetings Act requirements, and also add those clarifications that were suggested by the Office of the Attorney General.
Move to concur.
Any discussion? Is there a second?
Second.
Delegate Rosenberg. Okay. Delegate Rosenberg, do you have a question?
No, since it conforms, we're fine.
Conforms, yeah. Okay, all those in favor say aye. All those opposed to conforming the bill, please raise your hand. The bill passes unanimously. And I'm signing it while the request while we're here so that I know where we are in the process. Next, we're going to go to House Bill 968.
This is Health Occupations Dental Assistant Certification and Regulation. The amendments clarify the scope of coronal polishing that an expanded function dental assistant certified by the Board of Dental Examiners may perform.
I lost track of where I am.
Would have been in Health Occupation Subcommittee with Delegate
Yeah.
Kelly.
Yeah, this did not come through this. Oh, sorry. So this did not come through the subcommittee, but these are amendments that were agreed to by the stakeholders that just clarify the language, and we should definitely concur so that we can get this bill out.
Okay, will you move the concurrence?
Move the concurrence.
Second.
Discussion. All those in favor say aye. All those opposed, no. Please raise your hand. Passes unanimously. House Bill 1205.
This is the last cybersecurity bill. The amendments from the Senate make the bill an emergency bill. requires water and sewer systems that serve 10,000 or more users and receive financial assistance from the state to assess cybersecurity vulnerability and develop a cybersecurity plan. Moves the local cybersecurity support fund from Do It to MDEM. Adds new purposes and uses of the fund. Alters eligibility for assistance from the fund by requiring the locals to provide proof to Do It of cybersecurity preparedness assessment in the prior 12 months, or that they will undergo an assessment within 12 months. Defines cloud computing, requires the Secretary of Do It to annually evaluate the feasibility of units providing public services with emerging technologies and development of data analytics, renames the Oversight Commission to be the Modernized Maryland Oversight Commission, changes membership of the commission, and requires that updates and investments be completed on or before December 31st, 2025 from the first set of recommendations from that commission. Adds reporting to Senate EHE. The big change here, it does not make Do It a primary procurement unit. As the bill passed the House, Do It would have become a primary procurement unit. That language is struck, so they stay under DGS for their procurement. The BPW oversight exception that the House added would now apply to DGS, not Do It. And they add to the report to BPW the method of procurement utilized and the number of bidders. It adds procurement of cloud computing equipment to DGS's procurement authority. It also has a funds transfer from the dedicated purpose account to implement the act and an appropriation from the governor for fiscal year 2024.
Okay, and I am going to move not to concur because I believe we have things we need to do to adjust this bill, correct, Lindsay?
Yes.
Because we need a conference committee to produce some changes. So
Yes.
I'm going to move that we not concur and will appoint a conference committee. Delegate Cullison.
May I ask a question, Chairman?
Sure.
Lindsay, do you have a notion of why they did not want Do It to become a primary procurement agent? And they left it in
actually
DGS?
came in and testified before the Senate that they do not want to be a primary procurement unit.
Well, that explains it. Okay, thank you.
Delegate Hill.
Thank you, Madam Chair. Lindsay, I think, there are two questions. One is I heard that there was some issue about bringing the water under and that was not original jurisdiction. And then there was some concern that a Senate amendment that it sounds like the concurrence would not include, thank goodness, would have made Do It take response or take over local cyber if locals didn't live up to the standards. And I just want to be clear that that's not in there.
Yeah, so the water and sewer language, actually one of the suggestions for that the conference committee that's going to be appointed will be making is to move that water and sewer language to a special section and have them do the vulnerability assessment and, if appropriate, develop a cybersecurity plan by December 1st, and then report back to the General Assembly with recommendations for any statutory changes that are needed to improve the cybersecurity of those systems. And then there is language that was similar, if you recall, to language that appeared in one of the other bills. Looking for. Oh, actually, I'm sorry. Now I'm confusing myself on these bills. It was in 1202 that language appeared. That was for locals to certify to the Office of Security Management compliance with the minimum cybersecurity standards. And you're right, in that bill. So that's not in 1205. We're going back a little bit, but that bill had language that if they hadn't remediated the findings, then the Office of Security Management would assume responsibility for a unit's cybersecurity. And that language, also through the conference committee amendments that we're expecting to see, would instead have them providing guidance on how they can then come into compliance with those cybersecurity standards.
Okay, thank you very much. Okay.
Are there any other questions? Okay, we've moved to concur. I need a second.
Not to concur.
Not concur, not concur. All those in favor of not concurring, please say aye. All those opposed, please raise your hands. I don't see any hands. But, okay, we voted that unanimously. We will be appointing a conference committee consisting of Delegate Kipke, Delegate Rosenberg, and Delegate Young. Appropriations is second, so we have put Delegate Young on this particular conference because he is the co-chair of the cybersecurity task force work group, whatever it's called. Next we have, oh, that's that. Okay, we're going to turn to one of the other LAs for their list of,
I had one more.
you do?
I do. House Bill 1464. Maryland Loan Assistance Repayment Program for
Oh,
Physicians.
yeah. I've got that under Aaron. That's you. Okay, I got it.
This amendment is just technical. It clarifies the name of the advisory council by adding in physician and physician assistants reference. And this was actually, the two bills were not identical when they were introduced. So this is conforming it to the Senate bill as that was introduced. So there was no amendment needed on the Senate bill, but there is on the House bill.
Okay, I'll move to concur. Is there a second? Any
Second.
Thank you. Any discussion? All those in favor say aye. All those opposed, no. Please raise your hand. That passes unanimously, so we will concur on House Bill 1464. Okay, next, Lisa, you ready?
Sure.
Okay.
Start with Senate Bill 195.
Yeah, let me find it.
That's,
Yep,
that's the State Board of Examiners of Psychologists sunset extension. This is the bill that originally was a 10-year sunset or extending the board for 10 years. The Senate amended it to 2. We amended it back to 10. They refused to concur and sent back a message asking us to recede. I believe we are not going to recede and ask them to reconsider.
Delegate Kelly, would you like to say a few words about this?
Sure. So, and this is the psychologists and the,
Optometrists.
thank you. It's signing out. The optometrists don't expire this year. So this is not a must do this year. It is a must do by next year. So I think the committee felt like 10 years was appropriate. So I don't feel a sense of urgency. But I will say that the physical therapy bill is in a different posture. So we should keep an eye on that one because that is a must pass this year.
And I'll remind the members that an audit can be requested, or a sunset, whatever that word is, study can be requested at any time within the 10 years if there seems to be a problem. 10 years is the routine, that standard time that we've been using. So with that, I will call on Delegate Hill.
Thank you, Madam Chair. I'd like to ask Chair Kelly, I thought they would recede because it just didn't make sense. Did they give any kind of explanation, justification, or clarification why they thought 2 years when there had been no deficiencies was necessary for all those different boards, particularly
I
this
think
one?
they did have some concerns around some audit findings that have been corrected, and Lisa might have more information on this, but everything has been corrected. I think there might be just, there are concerns not particularly about these specific boards, but general concerns is what I understand, and sort of a desire for more, I don't want to say control, but more. And I think we all feel this with all of the health occupations boards, better communication and more functional oversight, which I do think can be accomplished with this new process that the chairman was just talking about, where we target the work of DLS to look where we do see areas and focus that at any time during the 10-year period, not just once every 10 years annually. So it's not that I think that they don't I think that there is general consensus among everybody on this committee and everybody in the Senate that we need to have better communication and better, I don't want to say stronger oversight, but a stronger cooperative process with all of the boards that is working better. And the reason I think that sticking with sort of the 10-year sunset, but doing these more thoughtful and targeted reviews as needed and appropriate in the spaces where they're necessary is going to work, is because I think it's going to lead us towards that. So I don't want to undermine that process that we just put in place a couple years ago. We're still getting used to that.
Okay, thank you. And so you're thinking we'll be able to, if we can't get them to give on 10 years, we can come back next year. Is there any thought to coming up with a compromise number like 5 or 7 years? Or you think that would be better to just wait till next year and fight it out again?
You know, I don't think there's anything wrong with coming up with a compromise number of 5 years either. I think that there's no urgency on this bill. I don't think we need to fight next year. I think we have all interim to figure out, and to work with our Senate partners to figure out together. This is a conversation I know Delegate Krebs has been working on already. Sort of, this is a big picture conversation, and I don't think the best decisions are going to be made under the wire in an urgent way through this process.
Thank you.
Okay, any other discussion? All those in favor of not receding, say aye. All those opposed, no. Raise your hand. We are unanimous that we will tell the Senate we will not recede. They are wrong. House Bill 625.
So this one is the establishment of the commission to study the healthcare workforce crisis in Maryland. The amendments make it identical to Senate Bill 440 as it passed the House, 129-1.
Move to concur.
Second.
Good, thank you for that. Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. We will concur. Let me make sure that this is all amendment. Yep. Erin, you're next.
Okay, House Bill 109 is the cross file to the newborn screening bill that with the amendment is identical to the Senate bill that you just passed.
I move the bill.
Is there a second?
It's concurrence.
Yeah, is there a second in the concurrence? Any discussion of concurring in this bill? All those in favor say aye. All those opposed, no. The ayes have it. I see no hands in the panel. It's unanimous. And next is House Bill 275, Erin.
Okay, this is the Pfas bill, and as amended by the Senate is identical to the Senate bill as passed by HGO.
So would someone move the concurrence?
Move to concur.
Second.
This makes it a take back instead of a buyback, just FYI. That's the thing that we're concurring. All those in favor say aye. All those opposed, no. The ayes have it. It's unanimous. House Bill 694.
So this was the bill about HSCRC providing for a process in which patients who paid for medical bills who would have qualified for free care could be reimbursed. There was no cross file. The Senate amendments to the bill would provide that the reimbursements that are provided for patients could be applied incrementally. And it also authorizes the HSCRC to modify the process as necessary. And it makes the bill effective for 3 years instead of for 2 years.
Move to concur. Is there a second?
Second.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. It's unanimous. House Bill 794. Erin.
This bill is the Opioid Restitution Fund Advisory Council. HGO was secondary on the bill. There was no cross file. The Senate amendments would add the Attorney General or their designee to the Advisory Council and also a representative of the Maryland Municipal to the Advisory Council.
Move to concur.
Second.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. The concurrence passes unanimously. House Bill 1188.
This is the comprehensive sickle cell disease bill, and it is a technical proofreading amendment.
Move to concur. Is there a
Second.
second? Discussion? All those in favor say aye. All those opposed, no. The ayes have it. It's unanimous. House Bill 1471. Aaron.
And this is the Garrett County Memorial Hospital bill, and it's also a technical proofreading amendment.
Move to concur.
Second.
Second.
Any discussion? All those in favor say aye. All those opposed, no. Please raise your hand. The concurrence is unanimous. Anything anyone needs to say or ask before we head to the floor for a long day in and out of session?
Madam Chair.
Yes.
Thank you, Madam Chair. May I ask about a bill that I was kind of hoping to see but haven't seen and wondering if that bill.
Hang on. There's a lot of background noise. Is that in the chamber? Is that from you? If it is, then we can't avoid it. But if it isn't,
Can you hear me?
yeah.
Oh, sorry. Thank you, Madam Chair. Thank you so
Sure.
much, Madam Chair. My question, I'd like to permission to ask about a bill that I had hoped to see but have not seen yet. May I?
Okay, yeah.
Yes, thank you. So we deliberated a bill, I think it was 751, about making whole the behavioral health providers, the Optum bill. And I was just wondering if we might see that.
Madam Chair, I think that was 715, if I'm not mistaken.
I wouldn't know the number from Beams, but I understand the Optum bill. There is a snag. I am working with the Senate on it. I continue to try to get a commitment from them that they will act on the bill. So we are doing the best that we can. The problem is not with us. So that's my very blunt answer.
Thank you so much, Madam Chair.
You're very welcome. Any other questions or discussions? Okay, with that, have a wonderful day in and out, and I will see you in the chamber. The session is over.